So breast cancer is basically abnormal breast tissue that divides abnormally in the breast duct, spreads to the breast tissue, and then moves to the lymph nodes and other organs. That's when it metastasizes. Usually, most people do not know they have breast cancer. By the time you notice a lump or a swelling or a discharge in your breast, you probably would have had this for about 4 to 5 years. We cannot say there's a cause for breast cancer, but there are risk factors which, when you look at all those risk factors, you know that, okay, I'm likely to have breast cancer or not. What are some of these risk factors? Being a woman is a risk factor. Growing old is a risk factor for breast cancer. Smoking, alcohol consumption, lifestyle, being obese, not enough exercise, and then there's the issue of some genetic mutations in your DNA. It does not necessarily mean that if you have all these risk factors, you will develop breast cancer. But then that's like an alert to you to be more careful about what you do in terms of screening and detection of breast cancer. What are some of the things I have to look out for to make you think that you have breast cancer? You could have a dimpling of your nipple. You could have a change in the skin around your breast or your breast skin. You could have a change in the size. And if you look in the mirror, maybe one breast might be bigger than the other. You could have a lump or swelling in the breast, even though most of the time the lumps and the swellings are painless. Once you have a painful discharge or a painful lump in your breast, that should be a red flag for you to go to the hospital. But once you hit 40 as a woman, you should be checking your breast, if not at all, at least once a year. It's good that we have Breast Cancer Awareness Month for October. The country goes live. Various corporate institutions are doing breast cancer awareness screening. I think you should be checking your breast every month at least. So what do you do? As a woman, usually it's advised that after your menses, you do that. You can lie down in your bed or stand in front of your mirror. Put your hand behind your head or lie in bed like that. Once you put your hand behind your head, what it does is that it helps you position the breast tissue against your chest. So it's easier for you to examine your breast against your chest. So then you move from the upper part, they'll say upper quadrant of the breast. So all the way round your breast, coming inwards till you get to the nipple. And then once you get to the nipple, you could squeeze the nipple a bit to see if there's a discharge or not. Again, in addition to that, you can examine your underarm and your axilla, which is your armpit, to find out if there are any lumps there. Because what happens is that one of the early signs could also be, though not too early, would be a lump in your armpit or your underarm. So if you pick anything abnormal, then you can go to the hospital or see a healthcare provider who will also further examine your breast and request some tests. So that could be an ultrasound or a mammogram. There's a lot NHIA has done and is doing towards removing financial barrier to diagnosis and treatment for breast cancer. Recently, there was a tariff review exercise where we had experts across all disciplines, surgery, laboratory medicine, and this deals primarily with breast cancer. So they went through the gamut of things needed to treat someone with breast cancer. The diagnostic related groupings have been made, tariffs have been set, and these tariffs are really looking good in terms of coverage for breast cancer. This benefit package or the coverage includes chemotherapy, radiotherapy, and the surgeries that treating breast cancer needs, which would be maybe a radical mastectomy, an excision biopsy. All these are covered under the scheme. When you go on to the chemotherapy, NHIA covers the use of Herceptin, which is around 6,262 Ghana cedis per cycle, and someone with breast cancer sensitive to the human epidermal receptors would need about 18 cycles of this. So if you do the math, that's like over 100,000 Ghana cedis, all covered under the scheme. Again, the National Health Insurance Authority is looking at costing the health preventive promotive benefit package, costing these preventive services, and we are looking at covering the screening for breast exam, where you can just walk in and say, I've come in to screen, where you don't have a lump, you don't have a mass, you don't have a discharge. We are looking at covering that as well. So in all that, there's a lot NHIA is doing in terms of coverage for breast cancer diagnosis and treatment. It is very sad to hear of someone dying from breast cancer. That should not happen. Given that NHIA covers the treatment of breast cancer, everybody should be mobilized to ensure that breast cancer is detected early and it is treated early to avoid unnecessary death. Health is a fundamental human right. Everybody has the right to stay alive. There's no point to die needlessly. Early action saves life. get tested and screened for breast cancer now.